Hey everyone, and welcome. Today we're going to take a deep dive into something millions of people rely on, the Albuterol rescue inhaler. I mean, for so many, it's an absolute lifeline. But do you actually know what's happening inside your body when you use it? Let's get into it. I want you to just imagine this for a second. That feeling where your chest gets super tight and every single breath is a major struggle. It feels like you're trying to breathe through one of those tiny coffee stir straws. It's a terrifying feeling, right? Well, that sensation, that's what's happening during an asthma attack, or what's called a bronchospasm. And that's exactly what albuterol is made to fight. All right, so here's our game plan for today. First up, we're going to look at the anatomy of an asthma attack. Then we'll introduce the hero of the hour, albuterol itself. After that, we'll get into the playbook, how and when to use it. And we'll wrap up with some really important warnings and red flags you need to know about. Okay, so before we can really appreciate the solution, we've got to understand the problem, right? What is actually going on deep inside your lungs when you have that awful feeling that you just can't get enough air?
And this really shows you the night and day difference. Over on one side, you've got a nice, open, healthy airway. It's like a big, clear highway for air to just flow through. But then look at the other side. During an attack, that same airway gets all inflamed, and the muscles around it just clamp down, squeezing it tight. It's literally choking off the airflow.
So that sudden muscle tightening, it has a medical name. It's called a bronchospasm. It's basically an involuntary muscle cramp happening deep in your lungs. And this is key. It's not just a feeling of being tight. It's a real physical event that is dramatically cutting off your ability to breathe. And that is the emergency we're talking about. Which brings us, of course, to the hero of our story. Let's talk about the medication that's designed to swoop in and save the day, often in just minutes, albuterol. Okay, so the official fancy name for albuterol is a short-acting beta-2 adrenergic agonist. Yeah, it's a mouthful. That's why everyone just calls it a SABA, but you can forget all that. Just think of it as a bronchodilator. Its one job, its only mission in life is to open up or dilate your airways, and to do it fast. So how does it actually do that? Well, the best way to think about it is like a key unlocking a door. All of your airway muscles are covered in these little tiny locks. They're called beta-2 receptors. Albuterol is the key that's perfectly shaped for those locks. When you inhale it, the albuterol key goes right in, finds those locks, gives them a turn, and tells the muscles, hey, stop squeezing, relax. And just like that, the airway pops open and you can breathe again. But, and this is a big but, here's the catch. Albuterol is incredibly fast, but it's not a long-term fix. That amazing relief you feel, it usually only lasts for about 4 to 6 hours. And that's exactly why we call it a rescue inhaler. Its job is to get you out of immediate danger, but it is not a long-term, everyday maintenance solution.
All right, moving on to what I like to call the albuterol playbook. Because let's be real, having this tool is one thing, but knowing exactly when and how to use it is absolutely crucial if you want it to work properly.
So when do you reach for it? Well, the most obvious time is, of course, during an actual asthma attack or any kind of sudden shortness of breath. But that's not all. A lot of doctors will tell you to use it before you exercise to prevent symptoms from even starting. And it's also a really important tool for people who need to manage flare-ups of COPD. Now let's talk technique, because seriously, this is everything. If you don't do this right, the medicine just ends up in your mouth, not your lungs. So here's the drill. Step 1, shake that inhaler really well. Step 2, breathe out all the way. Get all the air out of your lungs. Step 3, as you start to breathe in nice and slow, press down on the canister. Step 4, now hold it. Hold that breath for about 10 seconds. You got to give the medicine time to settle in. And finally, if you need a second puff, and this is important, wait 1 full minute before you do it all over again.
Okay, here is a pro tip. And this is for anyone out there who also uses a daily controller or maintenance inhaler, like a steroid. You always use your albuterol rescue inhaler first. So why is that? Think about it. The albuterol opens up the airways wide. It clears the path so that the other medication, the long-term stuff, can actually travel deeper into your lungs where it needs to go. It's like sending a snowplow to clear the road before the delivery truck comes through. Makes sense, right?
Okay, now we need to talk about something serious. Like any powerful tool, albuterol has some rules of engagement. Look, it's incredibly safe when you use it the right way. But you absolutely have to be aware of the potential side effects and, even more importantly, the big red flags.
And this is a great way to think about it. We need to separate what's pretty common from what's actually concerning. So feeling a little shaky, a little nervous, or feeling like your heart is beating just a bit faster, that's pretty common and it usually goes away quickly. But If you feel actual chest pain, or if your breathing gets worse after you use it, or if your heart rate is just going wild, those are serious red flags. That's not something to ignore. You need to let your provider know about that immediately.
And there are a few other things to keep in mind. You have to be extra cautious if you have certain health conditions, especially things like heart disease or high blood pressure, because albuterol can kind of rev up your cardiovascular system. It can also mess with other medications, like beta blockers. In fact, they can make albuterol less effective. And please remember this, overusing it isn't just a bad habit, it can really increase your risk for serious cardiac side effects. But all of that brings us to what is probably the single most important point I'm going to make today. The biggest, most important red flag of all isn't a side effect you feel in the moment. It's a pattern that you see over time. If you find yourself reaching for that blue rescue inhaler more and more often, that's your body screaming at you that your underlying asthma or COPD is not under control.
So if you walk away with nothing else from this, please remember these 3 key takeaways. Number 1, albuterol is for rescue, not for maintenance. It's a firefighter, not a fire marshal. Number 2, your technique matters a lot. Using it correctly is the only way to get the full benefit. And number 3, overuse is a warning. If you need it more and more, it's not a solution, it's a signal that you need to go see your doctor.
And that leaves us with one last big question for you to think about. That little rescuer in your pocket or purse, it provides amazing, life-saving relief, no doubt. But it's worth asking yourself, is your rescuer just putting out little fires while maybe hiding a much bigger problem with your overall lung health?
So you've probably heard these names thrown around: prednisone, beclomethasone, especially when it comes to breathing issues like asthma. They're both powerful anti-inflammatory steroids, for sure, but that's kind of where the similarities stop. One is a powerhouse for your whole system, and the other is a targeted specialist. Let's really dig into why that difference is so incredibly critical.
So you're probably thinking, okay, one's a pill, one's an inhaler. Got it. But what's the real difference? I mean, why would a doctor choose one over the other? That's the big question, and that's exactly what we're going to unpack today. All right, here's how we're going to break it all down. First, we'll talk about why these are controllers, not rescuers. Super important. Then we'll get into how they actually calm down inflammation. Number 3 is the main event, the whole systemic versus local difference. That's going to lead us perfectly into their side effects, and we'll wrap up with the absolute must-know rules for using them safely.
Okay, first things first. And honestly, if you only remember one thing, make it this. Both of these drugs are controllers, not rescuers. Getting this one idea straight can literally be the difference between managing your condition and, well, ending up in the emergency room. It's that big a deal.
So what do we mean by a controller medication? Well, think of it like this. It's something you take every single day on a regular schedule. Its whole purpose isn't to stop an attack that's happening right now. Nope. It's to prevent those future attacks from ever even getting started. It's all about long-term management and prevention.
And this slide just lays it out perfectly. Controllers like prednisone and beclomethasone are for the long game, daily prevention. A rescuer, like albuterol, that's your emergency brake. You use it when an attack is happening. So controllers are for managing the long-term war on inflammation. Rescuers are for fighting that sudden surprise battle.
Okay, so we know they're controllers, but how do they actually, control anything? Let's dive into the science just a little bit to see how they work their magic on that chronic inflammation in your airways.
So how do they take you from a swollen, mucus-filled airway to one that's nice and clear? Well, at their core, both drugs work by telling your immune system's overreaction in the lungs to just take a chill pill. This brings down that swelling in the airway lining, it cuts way down in the mucus that's clogging everything up, and it just generally makes the airway less twitchy and reactive. The end result? A much wider, clearer path for air to get through. Simple as that.
So here's the million-dollar question. If they both calm inflammation, what is the big difference? This brings us to the single most important concept we're going to talk about today: systemic versus local action. This is everything. Let's use an analogy. Think of prednisone, the pill you swallow. Taking that pill is like setting off the fire sprinkler system for your entire body. When you take it, that medicine hitches a ride in your bloodstream and goes everywhere, not just your lungs. It's a powerful, building-wide, systemic approach. Now, what about beclomethasone, the inhaler? Oh, it's a completely different story. This is like grabbing a fire extinguisher and aiming it directly at a small fire in the kitchen. The medicine goes straight to the lungs, right to the source of the problem, and it pretty much stays put. It's a precise, targeted, local approach. So let's put it all together in a table. You can see it clear as day. Prednisone, oral pill, goes body-wide, systemic. This makes it super powerful for really bad flare-ups, but it also means, yeah, more potential for side effects everywhere. Beclomethasone, on the other hand, inhaled, acts locally right in the lungs. And it's the absolute go-to for long-term control precisely because those systemic effects are so minimal. And that systemic versus local thing leads us directly to the consequences. Because one is a giant sprinkler system and one is a targeted fire extinguisher, they come with, you guessed it, a very, very different tale of two side effects. All right, since prednisone goes everywhere, its potential side effects can pop up, well, anywhere. We're talking about a higher risk of infection because it's suppressing your whole immune system. There can be weight gain, high blood sugar, high blood pressure, even mood changes. And with long-term use, you can see things like bone density loss or that classic moon face appearance. It's a really powerful tool, no doubt, but it comes with some serious trade-offs. Now let's flip the coin and look at beclomethasone. Talk about a night and day difference, right? Because the drug stays local, the side effects stay local too. The main risks are right where the drug makes contact, so you might get a sore throat, some hoarseness, or a fungal infection in your mouth called thrush. The contrast with the full-body effects of prednisone is, well, it's pretty dramatic. And that is why this all matters so much. It's why beclomethasone is the preferred choice for long-term control. You get that anti-inflammatory power right where you need it, in the lungs, while minimizing the collateral damage to the rest of your body. It really is all about picking the right tool for the job to get the biggest benefit with the smallest risk. Okay, let's wrap this up by talking about how to use these medications safely. Because whether we're talking systemic or local, there are some absolutely critical, non-negotiable rules you've got to follow. Here are the golden rules. For prednisone, you have to take it with food to protect your stomach. And the other huge one, and I can't stress this enough, you can never just stop taking it. It has to be tapered off slowly. For beclomethasone, the two biggies are use your rescue inhaler first to open things up, and then rinse your mouth after every single use to prevent thrush. Let's just walk through that inhaler process one more time because getting the order right is so important. Step 1, use your rescue inhaler, like Albuterol, and just wait a few minutes. This is like opening the door to your lungs. Step 2, now use your steroid inhaler. The medicine can walk right through that open door and get deep into your lungs where it needs to be. And finally, step 3, rinse your mouth with water and spit it out. This just washes away any leftover medicine hanging out that could cause thrush. 3 simple steps makes all the difference. So at the end of the day, we've got 2 tools. One that floods the whole system, and another that acts with surgical precision. This trade-off between power and risk is really at the heart of so many decisions in medicine. So it leaves us with a final thought to chew on. When you're faced with a problem, how do you weigh the awesome power of a broad solution against the clever precision of a targeted one?
All right, we've all been there. You're standing in the allergy aisle, staring at a wall of boxes. Your eyes are itchy, your nose won't stop running, and you just need some relief. But you know there's a catch. Grab the wrong one, and you might just be taking an unplanned nap at your desk. So let's get into it. Why do some of these pills knock you out while others let you go about your day?
It's really the biggest question of allergy season, isn't it? You're trying to stop sneezing, not go into full-on hibernation mode. Well, the answer is actually pretty fascinating. It all comes down to some really clever chemistry and, believe it or not, a super exclusive club happening inside your own body.
So first up, let's meet the villain of our story, histamine. When your body thinks it's under attack from an allergen, like pollen or pet dander, it releases this chemical. And histamine is what causes all that misery, the swelling, the itching, the sneezing, the watery eyes. Think of it as your body's security system going completely haywire. Okay, so to fight this villain, we need a hero. In fact, we've got 2 of them. They come from the same family, but they are from totally different generations, and they have very different ways of fighting the good fight against allergies.
On one side, you have the original, first-generation hero, diphenhydramine. This is the established, powerful, but kind of old-school solution. And on the other side, we've got the modern update, a second-generation medication like cetirizine. It was designed to be much more targeted and, this is the important part, way less sedating.
Now here's the thing, despite their differences, their main mission is exactly the same. Both of these guys work by blocking histamine from getting to something called an H1 receptor. You can picture them as security guards who stop histamine from getting into the building, where it causes all the chaos. If histamine can't get in, you don't get allergy symptoms. Seems simple enough, right?
But if they basically do the same job, why is there such a huge difference in the side effects? This right here is where we get to the big aha moment. It's the one key difference that explains everything.
So what is the secret? Why does that first-generation hero make you so sleepy? It's got nothing to do with how well it fights allergies. It's all about where it's allowed to go once it's inside your body. And that secret is something called the blood-brain barrier. Seriously, think of it like the bouncer at the world's most exclusive nightclub, a nightclub for your brain. This bouncer is incredibly picky about which molecules get past the velvet rope and into your central nervous system. And here is the plot twist. Diphenhydramine, our first-gen hero, is small and lipophilic. Basically, it has the right credentials to get past that bouncer. It waltzes right across the blood-brain barrier and starts blocking histamine receptors inside your brain. And that's what causes that signature drowsiness. Cetirizine, on the other hand, was specifically designed to get rejected by that bouncer. It stays outside the central nervous system, fighting allergies in your body without making you want to take a nap. So it's pretty simple. Where the drug goes determines if you doze.
Okay, so now that we know how it all works, we can get to the really practical stuff, when to use each one. Knowing this difference is everything when it comes to choosing the right ally for your particular allergy battle.
This chart lays it all out. For a sudden, really bad allergic reaction, you can see that diphenhydramine's power is recommended. But for managing those day-in, day-out seasonal allergies, cetirizine is the preferred choice. And what's super interesting is how that sleepiness side effect from diphenhydramine isn't always a bug. Sometimes it's a feature. That's why it's also used for things like insomnia or even motion sickness.
And this difference totally changes how you take them. Diphenhydramine is for those acute, short-term problems, so you might need to take it a few times a day. But cetirizine, with its non-drowsy, long-lasting profile, is built for that simple, once-a-day dose to keep you covered all season long.
And of course, with any medication, we have to talk about the fine print. Understanding the side effects and safety stuff is absolutely crucial, especially now that we know about that major difference in brain access.
So, because diphenhydramine gets into your central nervous system, the side effects go way beyond just feeling sleepy. We're talking about potential dizziness, confusion, even things like dry mouth or blurred vision. These are what's known as anticholinergic effects, which is a fancy way of saying they interfere with your body's automatic pilot system. That's why they're so much more noticeable with these first-gen drugs.
And right on cue, here's the good news. Second-generation antihistamines, like cetirizine, were literally engineered to avoid this whole list of side effects. By keeping the medicine out of your brain, you get the allergy relief you need without all that extra baggage.
This is a really big deal for certain groups of people. Clinical guidelines are very clear that you should use these first-generation antihistamines cautiously in older adults. That risk of sedation, confusion, and dizziness can lead to falls and other complications, which makes the second-generation option a much, much safer choice for a lot of folks.
And one last, really critical warning. This is something you absolutely need to be aware of, because first-gen antihistamines slow down your central nervous system, mixing them with other things that do the same, like alcohol, opioids, or benzodiazepines, is a high-risk move. It can seriously amplify the sedation. This one is non-negotiable. You have to be aware of these interactions.
So let's just boil it all down. You're going to choose that first-generation hero, diphenamine, for powerful short-term relief, or when you can actually use that sleepy side effect to your advantage. But you'll choose the second-generation hero, cetirizine, when you need to manage your daily allergies and still stay sharp, focused, and, awake.
And that kind of leaves us with one final thought. When you reach for an allergy pill, the goal is always to feel clear. But now you know that being clear means more than just clear sinuses. It also means having a clear head. So the next time you're facing that shelf, you can make a much smarter choice about which hero is the right one for you.
All right, let's talk about something pretty much all of us have in our medicine cabinets: cough syrup. We're going to dive deep into the two most common ingredients out there for stopping a cough: codeine and dextromethorphan. One needs a prescription, the other you can grab off the shelf. But what is the real difference, and how do you know what's what? Let's get into it.
You know that feeling, right? That dry, hacking cough that just won't quit. So you head to the pharmacy, and you're just staring at this wall of boxes. The labels are confusing. Do they all do the same thing? Nope, not even close. So today, we're going to clear all that up.
Okay, here's our game plan. First, we'll cover the basics. What's the goal of these medicines? Then, we'll hit the big one, the opioid versus non-opioid distinction. After that, we'll look under the hood to see how they actually work in your brain, compare the side effects, and, most importantly, wrap up with how to use them safely. Sound good? Let's go.
So first things first, what are we trying to accomplish here? Well, these medications, called antitussives, are specifically for a dry, non-productive cough. The kind where you're just hacking away and nothing's coming up. It's actually a bad idea to suppress a productive cough, the kind that's clearing out phlegm, because that's your body's way of getting all the gunk out of your lungs.
So, with that in mind, let's meet our two main players. In one corner, we have codeine, the heavy hitter you'll usually find in prescription cough medicine. And in the other corner, we have dextromethorphan, or DXM, which is the main ingredient in most over-the-counter stuff. And here's a little bit of trivia for you. Dextromethorphan was actually developed back in the 50s with funding from the US Navy and CIA, all to find a non-addictive alternative to codeine. Same goal, but, as we're about to see, very different tools.
And that brings us to the single most important difference between these two. And trust me, it's not just a label. This one distinction changes literally everything: how they're regulated, their risks, and their potential for abuse.
Okay, this is where it gets really interesting. Codeine is a full-blown opioid. That's why it's a controlled substance and has that schedule classification next to it. That's the government basically saying, hey, this has a real potential for abuse. But dextromethorphan, it's an opioid derivative. Think of it like a distant cousin. It comes from the same family tree, but it doesn't really act like a classic opioid in your body.
I'm going to repeat that because it's so important. An opioid derivative is not the same as an opioid. That's the key. It's the whole reason dextromethorphan has a much lower risk profile and why you can buy it over the counter. But, as we'll find out, that doesn't mean it's completely risk-free.
So how do these things actually tell your body to stop coughing? Well, neither of them treats the cause of the cough, like the virus or the irritation. Instead, they go straight to the source, your brain. They're designed to target the cough center in your brainstem and basically just turn down the volume.
For both of them, it's a pretty straightforward three-step process. First, they act on that cough center. Second, this makes it less sensitive, so it raises your cough threshold. That just means it takes a lot more to trigger a cough. And the result? You just don't feel that constant nagging urge to cough anymore.
But how they do it is what really separates them. Think of the opioid receptors in your brain like little locks. Codeine is like a master key. It fits perfectly into those locks, and when it turns, it doesn't just stop the cough. It also unlocks other effects, like sedation, pain relief, and even euphoria. Dextromethorphan, on the other hand, is different. It doesn't use that same key. It works on a different part of the system, more like flipping a specific switch that only controls the cough reflex. You get the cough suppression, but with way less sedation and without those classic opioid side effects.
And as you can probably guess, because they work so differently, they come with very, very different risks. So let's get into the nitty-gritty and compare the side effects.
Now, because codeine is an opioid, the list of potential problems is, well, pretty serious. The absolute most dangerous one is respiratory depression. That's a fancy term for your breathing slowing down to dangerous levels. But you also get a lot of sedation, dizziness, constipation, and, of course, a high risk for dependence and addiction.
Now, with dextromethorphan, the side effects are usually much milder. You might still get a bit drowsy or dizzy, and the risk of that dangerous respiratory depression is way, way lower. But, and this is a big but, over-the-counter does not mean risk-free. At really high doses, it can cause a kind of euphoria, and it absolutely has potential for abuse.
I want to pause here for a second and just zero in on that term, respiratory depression. This is the big one. It's the main reason opioid overdoses turn fatal. Your breathing just slows and slows until it stops. This single risk is the biggest, most critical danger that separates codeine from dextromethorphan.
Okay, so knowing the risks is half the battle, right? Now let's talk about what you absolutely have to know to use these medications safely, whether you got it from a doctor or just off the shelf.
This part is non-negotiable. Mixing either of these drugs with other things that slow down your brain, what we call central nervous system depressants, is incredibly dangerous. We're talking about alcohol, other opioids, or anxiety meds like benzodiazepines. The combination can multiply the risk of severe sedation and that life-threatening respiratory depression. And there's a special warning for dextromethorphan. Never, ever take it with a class of antidepressants called MAO inhibitors. The reaction can be fatal. Seriously, always check with a pharmacist.
And here's a number I want you to burn into your brain. 12. If a person's breathing rate drops to less than 12 breaths per minute, that is a 5-alarm fire. It's a clear sign of dangerous respiratory depression. If you're with someone who's taken an opioid like codeine and their breathing gets that slow, it is a medical emergency. You need to get help immediately.
But in that kind of emergency, there is a hero. It's a medication called naloxone. It's literally a lifesaver. What it does is it kicks the opioids off of those receptors in the brain and rapidly reverses the overdose, especially the respiratory depression. For anyone taking a prescription opioid like codeine, having naloxone on hand is an absolutely crucial safety net.
So let's wrap this up with a quick safety checklist. Rule 1, because of the drowsiness, don't drive or use heavy machinery. Rule 2, absolutely no alcohol. Rule 3, specifically for codeine, drink lots of water and eat fiber to avoid constipation. And most importantly, if you have any trouble breathing or feel super dizzy, you need to tell your doctor right away. And remember, these are for short-term relief, not for a cough that lasts for weeks. So what's the bottom line here? It all comes down to using the right tool for the right job. Codeine is a powerful, high-risk prescription tool that a doctor might use for a really severe, debilitating cough. But for most of us, for a standard, uncomplicated cough, dextromethorphan is the much more accessible, lower-risk option. But it's still a tool that you have to treat with respect. Ultimately, the best thing you can do is just be informed. Just because you can buy something easily doesn't mean it's harmless. So the next time you open that medicine cabinet and reach for relief, just take an extra second to look at the label and know what you're really taking. Thanks for joining me for this explainer.
You know that feeling, the unwelcome gas that shows up with a cold or allergies. That stuffy, blocked up, just plain miserable feeling of congestion. We've all been there. But then you get to the pharmacy and you're hit with this wall of options. It's a lot. So today, we're going to demystify that wall. We're going to introduce you to the congestion crew, the specialists designed to fight back. So first things first, let's get specific. Are we talking about a stuffy, totally blocked up nose? Or is it that deep, rattling feeling you get in your chest? It's a really important question because, as you're about to see, the treatment for one is completely different from the other. It's all about using the right tool for the job. So what even is congestion really? Well, it's not just one thing. It actually breaks down into two totally separate problems. There's the I can't breathe through my nose kind of stuffy feeling, and then there's that heavy, there's gunk in my chest feeling. And here are our two culprits. That stuffy feeling you get in your nose, get this, it's not actually from too much mucus blocking things up. It's caused by swollen tissues and blood vessels inside your nose. But that gunk you feel in your chest, that is all about thick, stubborn mucus clogging up your airways. See, two different problems mean we need two very different solutions. Okay, let's tackle that stuffy feeling first. For this job, we call in a real specialist, the decongestant. And the star player we're going to focus on here is phenylephrine. Its one and only job is to take care of that swelling. So what is a decongestant? Well, pretty simply, it's a drug that shrinks those swollen tissues in your nose. Now, technically, phenylephrine is what's known as an alpha-1 adrenergic agonist. I know, that's a mouthful. But think of it like this. It's basically a key, the agonist part, that fits into a very specific lock on your blood vessels, telling them to tighten up. And this whole thing sets off a fascinating little chain reaction. So phenylephrine hits those alpha-1 receptors we just talked about. That's the signal for the blood vessels in your nose to constrict or shrink down. That reduces the swelling, which in turn opens up your nasal passages and you can finally breathe again. It's a direct, targeted attack right at the source of that stuffiness. So when do you actually reach for it? Well, phenylephrine is going to be your go-to for that awful nasal congestion you get with allergies, the common cold, or a sinus infection. If the main problem is a blocked nose because of swelling, this is the specialist you want on your team. All right, now for problem number 2, the gunk. When your chest feels heavy and you've got this cough that's just trying to move stuff around, a decongestant is not going to help you. For this, you need the mucus managers.
guaifenesin and acetylcysteine.
First up, we've got guaifenesin, which is an expectorant. The easiest way to think about it is like a hydrating agent for your mucus. It works by pulling more water into your respiratory secretions. This makes that thick, sticky phlegm much thinner and way easier to cough up and out. It basically helps make your coughs more productive.
And then there's acetylcysteine, a mucolytic. Now this one's more like a demolition expert. Instead of just adding water to thin the mucus out, it goes in and actively breaks apart the chemical bonds that make the mucus so thick and tough in the first place. It literally liquefies it.
And here is where the difference really matters. You're going to find guaifenesin in a ton of over-the-counter cough medicines. It's great for thinning out the mucus you get from a regular cold. Acetylcysteine, though, that's a whole different level of power. Its ability to just dismantle mucus makes it absolutely essential for managing really serious chronic conditions like COPD or cystic fibrosis.
Okay, so we know who the players are and what they do. Now for what is, arguably, the most important part: how to use them the right way and safely. Because knowing how to use your medicine is just as critical as knowing which one to grab. Let's start with a big, bold warning, specifically for intranasal phenylephrine. See this number? 3 to 5 days. That's it. That is the absolute maximum amount of time you should ever use a nasal decongestant spray. And the reason why is really important. It's because of this: rebound congestion. You see, if you use a decongestant spray for too long, your nose can actually become dependent on it. So when you stop, the swelling can come roaring back, sometimes even worse than before. It creates this awful, vicious cycle. So the takeaway is simple: short-term use only. Seriously. Okay, here's a wild but really important fact about acetylcysteine, especially if you ever encounter it in its inhaled form. It has this very distinct, really unpleasant smell, like rotten eggs. It can be startling, but it is completely normal. It does not mean the medication has gone bad.
Of course, all medications have potential side effects. With phenylephrine, because it's tightening blood vessels all over your body, it can sometimes raise your blood pressure or make you feel jittery and unable to sleep. The mucus managers are a bit different. They're more likely to cause some drowsiness or an upset stomach. And it's really important to know that acetylcysteine carries a rare risk of something called a bronchospasm, a sudden, scary tightening of the airways, which is why it's always used with caution.
And that leads directly to who needs to be extra careful. If you have high blood pressure, any kind of heart disease, or a specific type of glaucoma, phenylephrine is generally not for you. And for anyone with asthma, both guaifenesin and especially acetylcysteine should be used with real caution because of that risk we just talked about. So, to wrap up the user manual, here are your key tips. We've hammered this home, but I'll say it again. Limit that nasal spray to 3-5 days. With guaifenesin, always take it with a full glass of water. It actually helps the medication do its job. And finally, acetylcysteine is often given as a mist you breathe in, and because it liquefies so much mucus, sometimes suction is needed to clear it all out.
All right, let's bring it all home. If you remember just one thing from all of this, let it be this: the secret to treating congestion is all about matching the right tool to the right problem. And here it is, your final cheat sheet. If you're feeling stuffy from swelling, you need a decongestant, like phenylephrine. Got a chesty, productive cough? You'll want an expectorant, like guaifenesin, to help you clear it. And for that really tough, thick, chronic mucus, that's when you call in the heavy hitter, a mucolytic, like acetylcysteine. So now you know. You're armed with the knowledge to walk up to that pharmacy shelf with confidence, not confusion. You actually get the why behind the different options. So the only question left is, the next time congestion strikes, which specialist are you going to call?